Pulmonary edema, commonly referred to as fluid in the lungs, and peripheral edema, fluid accumulation in the legs, are conditions that can significantly impact an individual's health. Symptoms of pulmonary edema include difficulty breathing, a feeling of suffocation, especially when lying down, and a cough that may produce frothy sputum, which can be tinged with blood. Peripheral edema manifests as swelling in the legs and ankles, and the skin over the swollen area may appear stretched and shiny. Treatment varies based on the underlying cause, but may involve medications such as diuretics to remove excess fluid and procedures to manage heart conditions if they are contributing factors. Common risk factors include heart problems, kidney issues, and certain medications which can contribute to fluid imbalance in the body. Here are detailed aspects of these fluid retention diseases and how they can be managed. Affected areas: lungs versus legs. Fluid accumulation in the lungs, medically termed as pulmonary edema, often arises from cardiac conditions like congestive heart failure, where the heart's diminished ability to pump blood leads to pressure buildup in the pulmonary vasculature, forcing fluid into the alveolar spaces. This manifests as breathlessness, especially when lying down, and a crackling sound when breathing. On the other hand, fluid buildup in the legs, known as peripheral edema, could be due to various causes such as venous insufficiency, kidney problems, or medications. Gravity plays a role, causing swelling more pronounced towards the end of the day or after prolonged standing or sitting. Identifying the specific affected areas aids clinicians in narrowing down potential diagnoses and crafting targeted treatment strategies. Nature of fluid accumulation, pleural effusion versus peripheral edema. Fluid accumulation in the lungs, known as pleural effusion, and swelling of the legs due to fluid buildup, termed peripheral edema, both result from different underlying conditions. Pleural effusion involves the collection of fluid in the pleural cavity, often due to heart failure, pneumonia, or malignancies, leading to shortness of breath and chest discomfort. In contrast, peripheral edema, commonly affecting the ankles and feet, may stem from venous insufficiency, chronic kidney disease, or heart failure, where the heart's decreased ability to pump effectively causes fluid to pool in the extremities, resulting in swelling and discomfort. Differentiating between these will guide clinicians towards targeted treatments, such as diuretics for heart failure or antibiotics for pneumonia, and address the root cause of the fluid accumulation. Common etiologies: cardiopulmonary issues versus venous insufficiency. Fluid accumulation in the lungs, known as pulmonary edema, and in the legs, termed peripheral edema, often point toward underlying cardiopulmonary issues. For instance, congestive heart failure can lead to fluid backup due to the heart's inability to pump efficiently, causing systemic and pulmonary congestion. However, these symptoms may also arise from chronic venous insufficiency, where damaged or weak vein valves in the legs struggle to return blood to the heart, resulting in fluid leakage into surrounding tissues. Differentiating between these conditions is critical and usually involves a combination of clinical examination, imaging like echocardiograms or duplex ultrasonography, and sometimes invasive procedures such as cardiac catheterization to establish the precise cause and direct appropriate treatment. Primary symptoms: dyspnea versus swelling. Fluid accumulation in the lungs, pulmonary edema, and legs, peripheral edema, can be symptoms of overlapping diseases but point towards different underlying pathophysiologies. Dyspnea, the feeling of breathlessness associated with pulmonary edema, often suggests cardiac conditions such as heart failure, where the heart's decreased ability to pump effectively leads to fluid backing up into the lungs. Conversely, swelling in the legs indicates fluid retention that might be due to venous insufficiency, kidney disease, or lymphatic blockage. Differentiating between these symptoms is crucial because it influences the diagnostic path. Imaging like echocardiograms for heart failure or blood tests for kidney function, guiding clinicians to the correct treatment to manage the root cause of the fluid retention. Potential complications: respiratory failure versus skin ulceration. The presence of fluid on the lungs, a condition known as pulmonary edema, can significantly impede respiratory function, potentially leading to acute respiratory failure. a life-threatening emergency where the lungs can't provide enough oxygen to the body or remove enough carbon dioxide. Left untreated, it rapidly worsens, necessitating immediate medical intervention, often in the form of supplemental oxygen or mechanical ventilation. On the other side of the spectrum, fluid accumulation in the legs, commonly referred to as peripheral edema, while uncomfortable and a sign of underlying pathology like heart failure or venous insufficiency, rarely precipitates an acutely life-threatening situation. However, chronic peripheral edema can lead to serious complications, including skin ulcerations. These ulcers are prone to infection, can be extremely painful, and often are slow to heal. Managing the underlying cause is crucial to prevent these complications, alongside elevation of the legs and, in some cases, compression therapy or medication.